And so we're back to talk about the next group of drugs that we use. Again, monoclonal antibodies made in a laboratory, manufactured and given to the patient because we think it will significantly disrupt an inappropriate excessive inflammatory response, causing awful clinical symptoms in patients with inflammatory bowel disease. This one's more of a mouthful. Ustekinimab, acting against an interleukin. I think it's 23. Kim, is that correct?
It is. It's 12 and 23.
Okay.
But effectively, this interleukin is it's more based on your skin. So actually, we're targeting the skin on your bowel.
Okay.
And this is where the ulceration tends to
You mean the
happen.
epithelium, we
yes.
call it. Yeah, okay.
So that's kind of where we're targeting it. It does mean that obviously it can be used for other skin conditions as well. So you might see that it can increase skin shedding, for example, in psoriasis. But that's not something our IBD patients need to be concerned about or need to worry about.
Okay. Again, it's something that it's a monoclonal antibody. If I just drank it or took it as a tablet, our digestive enzymes would literally make mincemeat of it. And that would be the end of it. Mm-hmm. So we have to come up with clever ways of administering this drug, bypassing the digestive tract, and we have devices. So Mel, you're faced with a patient like me who's come to you, and you're going to tell me how I'm going to receive this drug.
Okay. So Ustekinimab, or the brand of this is actually called Stelara, which most people can pronounce much easier.
Okay.
It comes as a mixture of infusions and injections.
Okay.
So the first dose, what we call the loading dose, is a large dose, and that's given as a drip on the infusion unit. So you would come into the infusion unit, you would sit and have your drip, which lasts over 1 hour, and then you would go home after about half an hour or so's observation. While you're on the unit, you can have tea, coffee. The nurses will, you can talk to other patients and people about anything you want to do. It's quite a nice informal place.
But again, there's a reason why you're in
the reason that you're in there is to make sure that you're okay with the infusion, that there's no problems and no reactions. Yeah. But also because it's easier to give you an infusion in a hospital, but it's in the infusion unit where they just do infusions all day.
Okay.
So once you've had that first infusion and you've gone home, you will then I will refer you to a home care company who will deliver the medication to you.
Okay.
And they will also provide a nursing service. The nursing service stays with you quite a long while with this one because Ustekinimab or Stelara lasts a long time in your body. So you have an injection every 8 weeks, potentially going out to every 12 weeks if you're doing really well.
So Mel, you have an injection or you give yourself an injection?
Well, the idea is that you give yourself an injection.
Okay. Or your best friend gives it.
Yes.
Okay.
or the nurse can continue the service. So this is using a pre-filled syringe. So I've got a before and after syringe here. So it looks like this, and anybody who's had any anticoagulation injections will be familiar with these. It does look quite daunting.
Yeah.
So, and what you do with this is, again, I'm going to demonstrate on my forearm because it's easier for you to see what I'm doing.
Will there be a needle
there? There will be a tiny needle on the end.
Yeah.
And you push the needle in, and it usually, you can go straight down or at a 45-degree angle, and you would just, at the rate that you're happy with, push the plunger down.
And again, to stress, it is usually not the forearm. It is usually around your belly button.
Around the belly button or on the upper thighs.
Okay.
And then you just withdraw the needle and you would throw that away. You get a sharp spot.
Because, Mel, it's not an intramuscular injection. It's a subcutaneous.
That's right.
You're looking for skin and lovely, slightly fatty tissue.
That's right, yes.
So the idea is that the drug deposits and it starts to disperse in a tiny
gradually, yes.
Okay.
So what will happen is when you've finished with this, the spring will pull the needle back into the sheath. That's a safety device.
Okay.
So you can't harm yourself afterwards.
Okay.
The nurses will come out and do 2 or 3, so it might be that they'll come out for a year. Because this is only very infrequently, a lot of patients forget between one and the next 8-week one how to do it and just want that bit more confidence before they fly solo, so to speak.
Okay, so I'm the patient. I've had my first one's always an infusion, correct?
That's right, yes.
And then you offer me these injections. I'm brave enough, and I have a nice best friend who can inject me every 8 weeks. I keep a stash in the fridge.
No, you don't actually keep a stash in the fridge. What will happen at the beginning is that the company will bring out or send out a one syringe for each dose, and that it is stored in the fridge between 2 and 8 degrees centigrade. A normal domestic refrigerator is fine, and they come in a box, so they're just about so big, so they're really not going to overwhelm your fridge.
Okay.
And you might, if you stay on 8 weekly, they might end up doing so that you have a spare, so you have 2 syringes, one to use and one for the next one.
Okay.
Okay, but you will only get these infrequently.
Okay. I think the response from our patients has been pretty positive so far. Would you agree?
Yes, it has, yes. A lot of patients like this. With all drugs, sometimes at the beginning, because we're giving you a large dose, some people do say they get a bit headachy with this medication, or after the initial dose, but that usually does settle down, and you might get the headache come back, but less strong with the next dose, and then disappear, perhaps the one after that.
Okay.
But you can use paracetamol and normal headache remedies.
Okay. What about citrate at the injection site?
There's no citrate in this one.
Okay, easy peasy then.
It is. Yes, a lot of people just have to get over that putting a needle in your arm.
Okay.
But the nurses are there to teach you, because the first one's always going to be the worst one.
Okay. That's really neat. It's really nice. And I think if the drug works, we're on a winner, because it prevents the patient coming into hospital unnecessarily, maybe even coming to a hospital bed unnecessarily.
Yes, potentially.
So really the potential is there for great quality of life, and savings, really, in terms of hospital time. Kim and Mel, anything else to add about Ustekinimab?
No, I don't think so.
I don't think so.
Okay, fantastic. Thank you very much.